Thank you. So the next one, thank you, Ideal Health, for sponsoring this webinar. So I'd like to welcome Jonah Barrow-Jones from Ideal Health to talk about the role of digital maturity in delivering transformational change. Jonah, welcome.
Hi, good morning, everybody. Can you see me, hopefully? Brilliant, that's a good start to it all anyway. So thanks everybody for being able to join me this morning and inviting us along. Ideal, we're very happy to be able to sponsor this event, and I'm a member of AphA myself, which is one of the reasons why I kind of wanted to be here. So let me just share a screen with you and we can crack on. So this morning, I know that the overall topic for the session today was this equals. And one of the things that we at Ideal often talk to an awful lot of different healthcare and social care organisations within the UK about is digital maturity. One of the first questions that comes out is, well, what does that actually do? What does that equal? Where's its place in all the other priorities that go on? So I thought it was actually a good thing to touch on today. And when we're looking at digital maturity, the first place to start is try to understand the definition of what is digital maturity, because there really isn't a clear one. And if you go and talk to 10 different people in different organisations, you will get 10 answers in terms of what digital maturity can cover. And it's important not to get too focused on the systems when looking at digital maturity, because in terms of fitting into overall transformation programs, the digital part is only part of improving that maturity. Looking at process and workflows and above all the people using systems is a critical part to actually improving and changing it. So don't consider it in terms of isolation, and don't just think of digital in that sense. So why is it important? Well, the big element of it, it's well accepted now and evidenced, as I'll come on to, that better digital maturity can lead to better clinical services, improve strategy, governance, and above all, improve the performance and financial stability and sustainability for organisations. That all rolls down in terms of what that equals to improving patient care and having better outcomes. So when we consider if there's a very difficult way to understand what digital maturity is, we still have a lot of challenges understanding or being able to measure what good looks like in digital health itself. So there's no real clear defined roadmap for NHS and social care organisations to take or even to guide process. And what you really need is some type of framework and methodology which can assess the actual state of digital maturity, understand the gaps that might exist, and then find a way to actually improve that and provide a tailored roadmap to improve that maturity and the adoption of digital systems as you move through this over time. Above all, it always has to be linked to the benefits and some real world outcomes. Technology, digital for digital's sake, it's a giant paperweight, and it just doesn't add value. So you need to understand what this is going to do in terms of what will happen for the organisation, but also if we're patient-centric nowadays, how that's going to affect their outcomes. And certainly COVID, I think, has shone a line on how digital can be rapidly scaled and changed. But we've rushed, into adopting virtual consultations, video consultations, remote patient management, and as we're moving, obviously, through a second lockdown now and moving forward, I think it's recognised by a lot of organisations that there's a lot of refinement needs to do in terms of seeing how to best realise using that in the longer term. So if we look at sort of why consider that digital maturity piece, well, there's actually a surprising amount of evidence rather than a lot of anecdotal stuff that we can all think about and name. There was a piece of work done a couple of years ago now which really demonstrates a direct correlation between digital maturity and improved CQC scores. So that table you can sort of see, apologies for being maybe a little bit small, on the right-hand side, looks at the different ways that the CQC measure healthcare organisations. And as if you can look at the overall digital maturity scores for the organisations, you can see those are more on the left-hand side scored more poorly than those who are more digitally mature. So ultimately, better digital maturity, better outcomes for patients. That's followed up earlier this year, and I don't know if anybody's actually read this or come across it. There was a National Audit Office report in May that was published, and one of the recommendations within that was digital maturity assessment as being critical to delivering digital transformation. And there was a lot of encouragement for the work looking at digital maturity to not only continue, but to really be embedded in everything we do as we deliver strategies and the work off the back of those strategies. We need to measure as we go along. Again, the digital maturity also allows us to make better informed decisions and understand the priorities for digital health prioritization investment. And as much as a framework's very helpful, I would always say don't get sort of bogged down looking at the numbers or the levels you're always at. What comes out of the back of doing a digital maturity assessment, what you need to understand is how that works for your particular organisation. As demographics, the services we deliver, how we deliver them are very different, and that's not just because you're in an acute mental health or community setting. I think the other aspect of looking at digital maturity in this way, it also really shines a light on process and workflow. I think far too often, we can point the finger at the tech as being the problem. Even if you look at simple things which have quite a large impact, let's say using out-of-date Microsoft Office to look at very large CSV files. And obviously what got reported in the news during the analysis on COVID numbers. It's not so much that, the wrong technology was used. It was used by somebody. So we need to understand the impact on process and workflow. Technology itself can be an enabler, but it does require solid process, good workflow, and people have to know how to use the technology and the digital systems in the appropriate way. And I think I've seen a lot of examples just recently where COVID has really shone a light on where there's a digital system in place, but it's clearly not working. We've introduced additional steps into how we treat and how we interact with patients because of that digital use of digital systems. So it's a critical way to move forward, and I think as everybody on this call will be aware, there's a huge drive now to look at shared care, integrated care, and how we deliver that. Massive amount of work going on within the STPs and ICS community in the development of shared care records, and understanding the broader digital maturity of all the different organisations involved lets you see if there's going to be bottlenecks or issues which are going to come along. It also allows you to see what areas and what organisations already have good best practice and how that can be shared across sort of a region as well. So I'd look at the benefits for digital maturity. There's two ways of looking at it. The natural way is always to look inward. What does it do for my organisation? And that's natural. That's the way we always look. It's where finance often drives us. But there's also a great deal of externally focused benefits as well. So being aligned to the long-term plan, the various reviews that have been done, such as Watcher and Topol, as we've touched on already, interactions with the CQC. What it can also do, though, is highlight issues and ways to have better interoperability with partners, shared care records, shared services, and so forth as well. They could be across different acutes, but more likely now, of course, is the delivery of better integrated care within that sort of STP or ICS that everybody's a part of now. So this is why it's important to think of things in terms of digital maturity, not just what it does for your organisation internally, but how that allows the organisation itself to interact better with other organisations. So we can start to look at longitudinal care across care pathways, which moves across different types of provider. So how do we do this? Well, we use HIMSS. I think most people in digital health and healthcare IT will have heard at least of HIMSS. HIMSS is an internationally recognised organisation. They're actually a non-profit, which most people don't realise. Their maturity models that they've developed over a long period of time are used in more than 50 countries around the world. And they don't just look at digital health from a systems perspective, as will come on within a couple more slides, but it looks at a very comprehensive view of digital health maturity. And they put a huge amount of work in creating stability within that, because as we all know, digital maturity doesn't change overnight. So moving, implementing change, installing systems, procuring systems, especially here in the NHS, can take time. So when you're wanting to move between things, you need stability in those models and, that you're using to allow you to move through them and know that the goals aren't changing underneath you as you're trying to do that work. So HIMSS, I'm just going to look at a couple of the different ways that HIMSS can look at digital maturity across different settings in different ways. One of the first things that HIMSS does is what's called a digital health indicator assessment. Now, the benefit with this is a snapshot. It's something any organisation can do for themselves. It's survey-based, and the benefit with this is it gives you a snapshot, but overall view of what digital maturity can be, what could cover. So it's not just looking at the systems, it looks at all the different aspects. So interoperability, that governance and how people are using the systems, analytics, which of course is quite an interesting point for AphA in particular, and then person-enabled health as we're moving forward into self-care, remote patient management and so forth as well. From the back of that, you can look at some of the other broader maturity models. As I touched on before, these cover all sorts of different areas depending on the sort of setting that you're in. O-EMRAM is the one everybody tends to have heard of first with HIMSS, which is the electronic medical record adoption model. And that's really focused on secondary and acute care organisations. And then moving through some of these others, INFRAM looks at infrastructure, because at the end of the day, having solid infrastructure, the ability to have access to systems and the infrastructure that supports sharing of data, good access to data wherever you need it, whenever you need it, is critical. So otherwise, you effectively build on sand. And that works not just for acutes, but of course, just about any other type of healthcare provider you can imagine. O-EMRAM's a little bit more interesting because this actually focuses on outpatients and clinic-orientated services. So this doesn't just affect secondary care, but can be used for community and mental health, who have obviously a lot of care and services delivered in that manner. AMAM is the analytics model for, it's the adoption model for analytics maturity. So this purely focuses on analytics and looks at the sort of analytics capabilities that go even beyond the clinical. So we're looking at operational financial management as well here. CCMM is different to all of the others because all of the others focus on an individual organization. CCMM looks at whole system maturity. So this isn't just looking at one organization, this looks at multiple organizations, such as an STP or even a LICA, which is dealing with multiple STPs and how they work together. And that doesn't just look at the digital side, but also looks at governance and strategy and also process and how clinical services work together and can be delivered. So in terms of sort of broader planning, looking at how organizations work together, CCMM is something which gives a very comprehensive view of the maturity of the system. And at the moment, we've just delivered one for the East Accord for 4 STPs down in sort of the East Anglia, sort of Suffolk area. and I'm doing one for the East Midlands at the moment, which covers 4 STPs across the East Midlands. And the idea with these is it gives an actual view of what's happening rather than what perhaps might be perceived. And it also allows any sort of regional delivery or plans in terms of how you integrate shared care records at an STP level can work beyond the STP level. Because as we know, patients don't just get care within STPs. They'll quite happily have to get care delivered outside of those borders as well. So how do you consider that? Finally, you have CCMM, which is looking at the supply chain within organisations as well, because obviously the delivery of care, as we've well been aware of during the PPE issues that we've all seen, and the requirement for that is, moving supplies into and through the organisation. How that works, how it's integrated into care delivery is also critical. So as you can see from these different models, and there are a couple of others on top of this, which focus on digital imaging and things like that, digital maturity is as wide as it's broad as it's long. So as I touched upon, what model works where? Well, as you can see, some work in particular areas and others can work across any type of care setting. And this is important to sort of consider when you want to do a digital maturity assessment, because you might not just want to look at doing O-EMRAM or CCMM. You might well then want to combine that with understanding the infrastructure that sits behind it. And quite a lot of the time, organisations will look at actually doing an assessment of digital maturity across a number of these different maturity models simultaneously. So I just wanted to touch on what some of these actually look like, what goes into them. HIMSS, all of their maturity models work on 8 levels. And you've probably seen in the press that we now have a couple of organisations in the UK, Great Ormond Street, Cambridge, who've achieved the highest level for NRAM and O-EMRAM. So, what happens in terms of the way people are assessed, a survey is done. Off the back of that survey, we come in, we do some reporting, some interviewing, we develop that into a report which gives an indication of what level you're likely to be. What we don't do is, if you then want to actually go and get a formal score, particularly if it looks like the organisation has scored highly, with a 6, possibly 7, it's well worth then getting a direct score from HIMSS themselves, which you can only get from HIMSS. And that will sort of give you a confirmed score. The benefit in also doing that is it gives you access into an awful lot of other HIMSS activities. You're certified at that level for 3 years as well. And you can promote yourself as that as well. So this maturity model, CCMM, is a little different to the others, because to move through the different levels of maturity with CCMM, you actually have to demonstrate that you've done at least 70% of a particular level before you can progress to the next level. So it doesn't matter if you have 100% of what would be measured for level 4, if you've only got 50% at level 2, you wouldn't go above level 2. O-EMRAM, well, this is where it is a little bit different, because moving between the levels within O-EMRAM, you have to fully achieve each of the requirements at each level before you can actually step up and move through them. But as you can see, everybody's likely to be at least 0 in the UK, because all the activities we've done in terms of moving away from paper, whether it's been paper light or paper free, we've moved up this scale. And certainly a lot of organisations in terms of O-EMRAM will certainly be producing at a level of 3 or 4. The challenges then are moving through that point in terms of developing, utilising personal health records, which might then rely on having HIE provision or other portals available to them to share data with patients. And the patient access to data might come secondary after they've actually created a clinical portal for sharing information between providers and healthcare professionals. The last one I wanted to touch on is AMAM. This might be more interesting for a lot of us who work within the analyst space and work with data a lot. AMAM is a little different because obviously it's not just focusing on the digital systems themselves, but the analytics part within that. So that can obviously consider whether we're using, or to this extent, we use real-time data versus historical data, and have to define what real-time data means. Is it polled instantly? Are we talking 1 hour, 4 hour, 24 hour type of time lags involved? That's very much linked to how we poll and access data warehouses and the systems that we actually use. The other aspect, of course, with analytical data and reporting is, how do we interact with that? How easy is it to get hold of it? To what level are we aggregating data in different ways? And off the back of that, how do we report off it? What type of reporting are we doing? Is it self-service? Is it something we have to push through performance and quality IS teams? And then off the back of that, of course, we move to more advanced things using analytics, development of modeling, and then that evolution from there to introducing machine learning, AI in different ways, and the drive to sort of population health management, understanding the broader economics of care, which then might be taking you outside of an individual organisation, looking at the sort of how data is used, shared across different organisations as part of an STP. The governance strategy as well as is quite important within AMAM as well. So are we using dashboards or even multiple dashboards within a command center sort of structure? And how do we access, can everybody use analytics? And how standards are applied to that as well. And then, the impact of how we're using analytics in terms of improving operational, clinical, and financial effectiveness. So, to work with HIMSS, you have to be a certified organisation, of which there are only a couple in the UK, and by far Ideal is the most active of those in the work that we do. So why do we add value into this? Well, we normally work with an organisation in a number of ways, in a phased way. So the first phase is we come in and actually do the survey with you, map the current state of maturity, create a gap assessment for that as well. So you can actually see in an unbiased way where you actually stand, an actual picture, rather than something that might be perceived from internal views. And yes, surprisingly enough, there are differences between that. The next element is we come in and help you develop the change strategy and the roadmap on how to use that, what to do with that, recommendations that we might have actually provided to you, sort of improve your maturity across different types of system, different settings, and how to get there. And if necessary, and if an organisation feels they wish to, we can obviously support the formal HIMSS validation when HIMSS come in to do that as well. Now, to do that, we use a team of trained and experienced HIMSS certified consultants. They've gone through HIMSS training and are certified through that, and more to the point, have really solid contextual experience in terms of how digital maturity can be applied in these different ways. And as you can imagine from those different maturity models, you want different types of experience when looking at infrastructure versus clinical delivery, using the system, to utilising analytics. So it's not a one-size-fits-all whatsoever. So this is just a quick way of sort of looking at what that process looks like. So someone might start with a digital health indicator, or they can actually move straight away to looking at doing a particular set or individual maturity model. From that, the assessment gets done and the gap analysis. And then if we want to take that further, then we can look at how we prioritize the recommendations, develop roadmap, and then look at the benefits that might come from that. Because going right back to the beginning, anything you want to do with this really needs to be tailored to the type of benefits that you want to drive for your organization. And let's not forget that a lot of that might be then going into broader change and transformation programs. So it's not just about the digital here, it's also looking at the impact of those benefits and the relationship with those benefits in terms of doing process redesign and improvement as well. And then actually using those beyond that, how do you use digital maturity? Well, one way is obviously feeding into the digital strategies. And there's a lot of work obviously been going on in recent times as people have been updating local digital roadmaps and updating digital strategies, particularly on the back of COVID. And I know there's a lot of work ongoing in that area. It can be used to support business cases as well. Obviously, if we're buying larger systems, then we have to develop business cases of various complexities. So a lot of the information and data that we capture can be used in that way. Funding applications for this in the same way. The other aspect is, it can be used to actually sort of validate and verify ongoing development and implementation plans. Are you doing things in the right order, in the right way, to give you the best benefits, best bang for your buck, and identify also if there's any better low-hanging fruit in terms of those benefits. And then, let's look at the broader impact on transformation programs. Most transformation is digitally enabled nowadays. So having this information to be able to roll into that can better impact the success or the effect of broader transformation programs. And again, even when you're looking at individual organizations' digital maturity, it does sort of shine a light on how you can be improving interoperability and working with other organizations within that integrated care environment. And ideal, we work with organizations across all of these areas. So in terms of the digital maturity itself, we work obviously with phase 1, phase 2, and then in terms of the outputs and how they can be utilized, we work across all of these areas as well, across the country in all different care settings. So I thought it might be useful just to sort of conclude with some real world examples of what's the impact of using digital maturity. And these are some of the ones that we ourselves have worked on across the country. So in terms of Bury, a local digital maturity assessment there and a whole load of interoperability mapping with the local acute really created an understanding of how to roll down from doing something which is quite a technical activity, looking at interoperability, interfacing work, both within the acute and with local organizations, then allow them to accelerate and deliver across 21 patient-facing projects, linking different services across that local space. Some of you might have already heard of the Digital Red Book for Children's Health Services. This is an electronic personal child healthcare record. And we did an awful lot of the work around the piloting for this, which has now sort of been adopted more broadly. New sign-ups across Lancashire, London, Bristol. And that, of course, is impacting care for kids within CAMS, social care, and healthcare provision. And as I touched on before, we're just in the process of completing one of the largest digital assessments across a group of organisations with a CCMM assessment for the East Accord. So this is the LICA covering 4 SDP ICSs. And that, like the one I'm doing for East Midlands, is very much feeding into their investment planning, the business cases, and the digital roadmap across not just how individual STPs work, but how they can work together. Because obviously patients in quite a rural area like East Anglia and Suffolk will move across different care areas in terms of getting the best care for themselves. And these ones here are really looking at how we improve capability, improve capacity, shared working. But there's also ways to look at the external focusing benefits that I touched on before. So this is even creating clinical and competitive differentiators for organisations, because at the end of the day, whilst the NHS is a public body, we work within an ecosystem whereby foundation trusts are obviously looking at gaining contracts outside of their immediate area. So, HIMSS and having high HIMSS scores has a difference in that respect. So most recently you've seen GOSH reach O-EMRAM stage 7. That will allow them to actually build on their reputation as being a leading specialist centre. And I think we can sort of safely say that that does attract funding, for them being a charitable organisation, private patients from different parts of the world, and get the best clinicians in terms of providing specialist care for children as well. Cambridge, even before they've attained their NRAM stage 7 just recently, they beat a South Coast trust for some work for renal dialysis from the Channel Islands. So if you think of the distance from Channel Islands to somewhere on the South Coast versus the distance between Channel Islands and Cambridge, there's a big difference. But the award of that contract was really given on the basis that it was viewed as Cambridge, with having a very good use of digital systems, would be able to offer better care to patients, even though it's actually twice the distance away. So digital maturity can be used in a variety of different ways, and it's important to think about it, just not in isolation. But hopefully this is giving you a little bit of an understanding of how digital maturity equals a range of different benefits, and how different organisations within the NHS can use it in different ways. That's it. Thank you, everybody.
Thanks, Jonah. Thank you. We're out of time.